Good afternoon, everyone. This is Harley, DDSN. We're about to start, but I want to request that everybody please mute your microphones to keep there from being feedback, and then we'll get started in just a second. Okay, again, thank you all for joining us for the September monthly provider meeting. In the room, we have Ann Dalton, Janet Priest, Quincy Swigert, and myself, Harley Davis. Lori Manos is on Teams with you all. The first agenda item are updates from DHHS, so I will turn it over to Margaret.
Hi, good afternoon. Let me check and make sure that my microphone is working. Are y'all able to hear me okay?
Yes.
Great. All right. So a few updates. Thank you for the time on the agenda. I know there are questions out there regarding the 5% increase that will be retroactive to July 1. We are still working to finalize those rates. FTE surveys did go out to all of the DSN boards. That was necessary in order for us to identify for the Executive Budget Office what the amount of appropriation transfer was based on that, since the proviso itself only covers the DSN boards. We do plan to pass this increase through the rates as we did last year, so it will be a very similar process. That rate update will go to all providers of waiver services for DDSN operated waivers. There will also be a component for early intervention services. Again, very similar to the process for last year. So we will be completing retroactive rate adjustments once the final rate has been updated. We will announce that in a Medicaid bulletin as soon as those rates are finalized. So that will outline what the new rate per unit will be for the identified services. And we hope to have an update on that shortly, but wanted to give you just a status of where we are. Again, hopeful that that will be forthcoming. We will announce it in a bulletin and will adjust retroactively to July 1 for the period of time between July 1 and the time that all systems are updated with the new rates. I know there are also questions in terms of any updates to cost report requirements. I believe the current audit process, I won't speak for DDSN, but I think that was left the same as last year to go ahead and proceed with that. I don't have an updated timeline, but we will be providing information as it becomes available.
So, Margaret, there's a question about whether or not it includes case management, so you might want to clarify that.
Sure. So in alignment with what we did for last year's rate increase, that did include waiver case management as a waiver service. It did not, to my knowledge, include Medicaid targeted case management. All right. Also, by way of update, we are working with our project management office and with DDSN to provide updates on our project for transitioning community ICF billing to direct billing. We expect that to take a similar time frame as our prior project with the transition to direct billing for waiver services. We have started that project planning, process mapping, and identifying the actions that will be necessary. We expect and our current target is for July 1 to be our implementation date. Again, we'll be working very closely with the provider community to move through that transition. That is going to take some different steps. So there will be a component, and we've already begun having some discussions with selected DHEC staff in terms of change of ownership, licensure questions, things of that nature that will need to be incorporated into the timeline. But our intent is to, if at all possible, craft a project plan and be able to implement as of July 1.
So Heather, it seems like Heather might have not understood completely, but I think she got it. 7/1/24 is the target implementation.
7/1/24.
You got that right, Heather?
Great. And so we will be providing materials and more detail similar to what we did with the waiver direct billing transition that will outline specific steps, training sessions, milestones, and dates along the way. So that level of detail is forthcoming, but did want to share that update. And there will be certain components of the project. DDSN may want to speak to this in terms of some of the administrative functions, the 181 process, some of the consumer banking actions. So we'll be working very closely with our partners at DDSN for all of those components of the transition. Also want to give an update that we are currently working with DDSN in terms of the feedback received from the proposed revisions to the incident management directives. We've done some deep dive discussions around the public comments that were received. We will be identifying a date to get back together with a small group of providers. We heard you loud and clear that you want to be at the table and be part of that discussion as we review potential revisions to those policy updates. So we're in the process of finalizing some discussion with DDSN on a proposed approach, and then we'll be reaching out to get additional information and to set some dates for a small provider group to help us with that next step of that policy revision.
So Margaret, there's a question related to cost reports, and I'm not sure if you or Quincy need to speak to it, but the question is, can you provide instructions for how and where cost reports are supposed to be turned in? Is there an email address? Do they mail it? Do they mail a copy somewhere?
I mean, this is Quincy. We still have like the same email address. It's cost and the number 2 at ddsn.sc.gov. But I don't know where Margaret wants those or where Brad would want those sent to. If it's just the reimbursements at DHHS, I'm not sure.
Yeah, we will send out specific instructions and how to turn in that information when that is finalized. Again, anything related to audit process or current information should go to the email that Quincy indicated.
So I want to make there's a comment that they're due next week. They're due October 1st. So if they don't have any new instructions, they should send it to the email address that Quincy just provided. Is that correct?
That's correct.
And if there's providers out there that have not requested for an extension that may need an extension, that has to go to internal audit and Courtney Crosby as she's approving those. But if you guys need that extension, please route those toward Courtney Crosby. And I think all that information is contained in the policy that's currently out on our website.
Okay, one other reminder I just wanted to make mention for those providers that currently have a single case agreement in place. There are not a whole lot of these, and we would expect them to certainly be the exception rather than the norm. But for those few that we do have in place, please ensure that you and your staff review the billing information for the single case agreements. It's kind of a two-step process for reimbursement. One is billed through the regular code and regular rate, and then there is an additional step billed through a 1,500 claim form for the outlier or additional payment that's been agreed to. So if there are any questions for any providers that do have that in place, please feel free to reach out. Our team has been wonderful in walking through the specifics. If there are questions on that billing process, we have had a couple of instances where it was billed incorrectly or didn't get routed to the right place. So we want to make sure we try to troubleshoot that on the front end, given that it's a bit of a new process. So if any information that you may need, if you do have a single case agreement, we're happy to help with that.
So Quincy,
Thank you,
there's one other question related to cost reporting, and it says that October 1st is a Sunday. So is the date where you would need to ask for an extension the Friday before or the Monday after?
You know, I'm fine with go ahead and saying as long as they get their extension request in by 5 days before the October 2nd, I'm fine with that. And then we can just grant that. I know this year's different than years past because, DHS is a lot more involved than they have been, and usually it was just us putting it together. So I realize there's, a difference this year than years past. So we're going to give grace as much as we can. So just, email Courtney and myself for those extension requests, and we'll get those approved.
All right. Those were my updates. I appreciate your time today. Thank you.
Thank you, Margaret. We can turn it over to Lori now.
Hi, so we had a couple of questions related to case management that were submitted to the email box. One of them was related to the problems with access in case management and kind of how big of a problem that is. And then it was kind of, are we taking on the cases that, we're having a problem with? So the answer to that question is a little complicated because the truth is there is a big access problem, but it's only for a select group of people. Providers really are not interested in taking non-waiver cases right now. We've had a lot of providers just say we don't want non-waiver cases. Even providers who have said they're taking cases in certain areas, when we try to make referrals, they kind of don't want those cases, but they'll take other cases. So the answer is yes, we are working a good number of them at our level right now. We're almost tapped out from it. We do have people who are kind of waiting to get to providers, but it is kind of a very specific group. We've not had a lot of trouble with waiver cases that are established moving from one provider to another. But we have had, an issue with the other. So it is extremely concerning and something that we're really trying to monitor and figure out the best way to approach. there was also a question about inactive cases and whether we'd thought any more about paying providers to maybe do kind of a annual contact or something with those cases. We, at this point, it's not off the table. We need to address our access problem first. So I think that might be part of it, but.
Do you think, Lori, do you think that might help with the access problem for those non-waiver cases?
No, I don't. I mean, we've made contact with everybody in the last year that was inactive through a project. So it's not really, that's not real. When cases crop up and there are issues, it's usually not because there hasn't been an annual contact. It's just something that has happened. But I mean, we've just really seen an increase in people in crisis. I mean, I know you guys know this. And for those people, there's just no provider who really wants to take them on. Even some people who are not in crisis, they just call in. They're kind of these newly eligible folks who are interested in a case manager. Providers don't want to take those either, right? It's kind of, again, I've gotten in writing from several providers, we will take established waiver cases. That's it. So I don't know if it's a rate issue. I'm not sure what it is, but it's definitely a problem. And we're just kind of keeping a list for the people who need something right now. We're doing it. If they need active case management, we're providing it. Sometimes even the people who are calling in, sometimes we can make referrals for them and, kind of get them where they need to be for a moment. So Susan has a comment. Other issue is inability of receiving agency, not being able to see the notes of the previous provider and the ability to really get a good understanding of what's been done, what may be important. Is there a way for a CM to see the historical notes? So my understanding, Susan, is that if you run the note report, you can see the notes from the previous provider. It's just not as easy to see in the search function because the case notes actually live in the case management provider account instead of the oversight account, like where some of the other ones are. If that's not true, you have to let me know. But I also think that I know, at least from my level, I can do a search function using the oversight ID, which you have to go to CDSS and get it, put it in there instead of putting somebody's name in there, and I can see all the notes through a search in that way. So I don't know if that's helpful. All right, that's all I had for case management.
Lori, this is Margaret. I forgot to mention one item.
Okay.
If you don't mind, mentioned this on another call recently. One of our topics that we're going to be tackling over the course of the next year, as we identify priorities for our provider manual updates, is targeted case management. So we're going to be doing a deep dive and updates, revisions to our targeted case management provider manual. That's going to be a really in-depth review and update. It's been a little while since we've addressed that particular service and manual. So just for the good of this group, wanted you to know that's on our topic list for the next year. We certainly do want to include and incorporate a good bit of input and stakeholder involvement as we go through that process. So I may be reaching out for volunteers. Just wanted to let you know that's a topic that we are going to be reviewing in depth over the next year. Thanks.
Margaret, this is Heather. Would it be helpful if we were to, as providers, go ahead and start soliciting who might be interested in having a voice at the table on that and send you a list of providers? Would that be helpful at all, or no, just wait for your guidance on that?
Hey, Heather, I think that would be helpful. So we would
Okay.
already be, one step ahead with prospective lists of folks to assist us. So yes, absolutely.
Okay. Okay, we'll be happy as an association to kind of get some of those names for you.
That'd be great. Thank you.
So I think we're ready for the quality management updates. This is Ann Dalton. I just wanted to make sure that everyone knew that the review tools that are used by the Quality Improvement Organization, Alliant, are available on the DDSN website under the Quality Management Division. We've had some questions recently about where to locate that information, so I just want to make sure everyone is pointed to that particular link on the website. That includes the administrative compliance and individual services reviews, licensing, and also the day and residential observation participant experience surveys. Also on the DDSN website under quality management, we have information related to the post-payment claims review process. This process is definitely moving forward. We've been talking about it for over a year now, but I've been surprised recently in conversations with providers who seem to be surprised that we were about to implement this process. So I just want to make sure that everyone is checking out the website and that you are aware that we are moving forward with post-payment claims review. We have 4 staff in place now, and they are currently completing test runs with other reviews of documentation that's currently available in Thera. We are awaiting receipt of the samples from DHHS in order to begin the actual review process. As information comes up during a regular review, whether it's through incident management or reviewing an appeal that might have come in for a different review, when our quality management staff see something, we are trying to educate providers about the post-payment claims review process and call your attention to documentation that may need to be beefed up. So we see a lot of T-logs that don't necessarily correspond to GERs. And we see a lot of information, a lot of T-logs that simply say that Johnny had a good day or he enjoyed his pizza for dinner. They're really talking about more custodial care and not actual service delivery. So I cannot emphasize enough that attendance is not service delivery. There must be documentation of the billable Medicaid service for each unit of service that is claimed. We need documentation that meets the waiver service definitions. And I ask you guys to look at the day service, particularly day service providers, look at the service that's authorized. Your documentation for career prep is going to be very different from your documentation for day activity or community services. So within the post-payment claims review, just to recap, there will be a 3-year cycle for all providers. Every 3 years, the claims for services delivered by that provider will be reviewed to determine whether the service recipient was eligible for services at the time of the claim. So were they eligible for Medicaid and were they eligible for the waiver? Does the person's support plan document the need for the authorized service? Is there a properly executed authorization present? Do the units of service delivered align with the authorization? And is there documentation to support service delivery for each unit of service that was claimed? Please refer to that post-payment claims review link, and we will continue to share information as this process moves forward. Also, I want to make providers aware that there are some updates to data fields on the incident management system. These will be going into effect on October 1st. I realize that's a Sunday, but remember, reports are due within 24 hours or the next business day following an incident. So as you begin to enter your reports on Monday, October 2nd, for anything that happened over the weekend, you will notice changes to the reporting format within the IMS.
The directives did not change. So Directive 53402 for A&E reporting and 100-09 for critical incident reporting did not change. The update to the data fields will allow us to gather more specific information about the type of incident. And in particular, it will help us distinguish the reports that are taken for information only or those that involve injuries of unknown origin. We're creating some subtypes for different types of allegations of abuse or critical incidents. There will be summary information added as a banner when you log into the DDSN applications portal. Information has already been uploaded to Business Tools and to the DDSN website that will outline the changes. One more thing for clarification. We've had a few providers that have indicated they did not think they needed to provide DDSN with updates about their remediation as it related to A&E or critical incidents. And I want to emphasize that we do need documentation of your remediation. This is something that we have always required. An addendum that documents that whatever actions you indicated the agency would be taking as part of the management action and your risk management actions, we do need evidence uploaded with an addendum. And this would include your training that was recommended in an ombudsman report as an example, or other personnel training, personal actions, other training that may be indicated. If you have any questions about the incident management reporting, you can always reach out to Tamu Williams or Tana McCarthy, our incident management coordinators. Thank you.
So, Ann, there's a question about post-payment claims review and whether there's going to be any kind of grace period on documentation being present. And then there's kind of a site of how they've found some things that weren't so good, and now they've implemented a better use of, like, the T-logs, for example.
I am not aware of a grace period. We've been talking about the implementation of post-payment claims review for well over a year. Ultimately, I guess that's a decision that the folks at DHHS would make, but our process will be to gather the findings from the review and to pass that information along to DHHS through program integrity.
Thank you, Ann. We will take another look at that and take it under advisement.
Yeah, there's some stuff about the finance manual defining billable units. I will say, at least in the past, when program integrity has reviewed us, we still had to have documentation, right? That the service was provided.
There's also an appendix that's been uploaded with the post-payment claims review link on the DDSN website that includes the every waiver service and the billable units.
Right. I think the point is we've always had to we've always had to justify the amount of service we build, whether we build it on your behalf or whether you build it yourself, right? So in the past, if we had a review from Medicaid and Medicaid said, prove to us that residential habilitation occurred on this date, we couldn't just pass them an attendance log, right? Like, we had to come up with documentation that the service was delivered on that day. It didn't necessarily mean it's in a T-log, right? It might be some other documentation that supported care supervision or skills training.
That's all I had.
Lori, are there any other questions, or can I go ahead?
I think you can move forward.
Okay. So this is Harley. I have a few communications updates for you all. For one, I wanted to state that we will plan to host one more in-person monthly provider meeting this calendar year. So I'm looking at October or November. The current schedule has the November meeting occurring the week of Thanksgiving, so we'd probably move it to the last week of Thanksgiving, but we'll make that decision really soon and share that information with providers. And then at that next in-person meeting, we can also assess if we want to keep with the general quarterly schedule of in-person or maybe move to bi-monthly. So please start thinking about that, because I'll gather that input at the next in-person meeting whenever it occurs. I wanted to put a plug in for the holiday market that's scheduled for December 7th here at DDSN Central Office. And so communication has already been coming out from DDSN regarding sign up and participation. I also wanted to remind DSN boards that the meet and greets are scheduled for this month, the end of this month, as well as into October and November. So we do have the Witten Center meet and greet on Wednesday, September 27th, and then the PD Center meet and greet on Tuesday, October 3rd. So y'all, providers that are participating have received communications about that, but again, I'm listed as the point of contact, so please feel free, please feel free to reach out to me if you have questions or need additional information. We did get a question that came in about the LAC, the Legislative Audit Council draft report. So DDSN does acknowledge receipt of the draft part 2 of the report, and we're working on a response to that. Finally, a question also came in about the acuity assessment. So we've started the process internally at DDSN to procure a vendor to pilot the assessment. And so we will be in touch with providers once that contract is in place to discuss logistics and ensure that it is a coordinated effort with providers. Hopefully that will happen in calendar year 23, but we will see. And so I will provide information as it is available. Those are all of my updates, unless there's any questions.
I don't think so. I think we're good. Oh, wait, one thing. I do see something. So Grady commented that the AAIDD conference is at the end of October and could conflict with the next monthly provider meeting. So we might want to move that date or something.
Let me just write that down. So the AAIDD conflicts with that.
What are the dates, Grady? I think they're like the end of that week, right?
You are correct. It's the end of the week. It's Wednesday, Thursday, and Friday, but that week is typically the same week as we have this. So an in-person meeting might put people on the road a lot that week, was my only thought.
Yeah, we might want, we'll talk about it and try to look at the dates and see if we can do a better coordination.
Yeah, that's very helpful to know. That's the kind of information that is helpful for us as we decide. You know, I obviously didn't want to host an in-person meeting the week of Thanksgiving. So, you know, looking at what y'all have, what's going on in October, we can maybe just keep that one, the Teams meeting, and then offer the in-person option for a November meeting that would be rescheduled for that last week, the week after Thanksgiving. So thank you for sharing that.
And Harley, there's some questions about the meet and greets and who the communication around them came from and who it was sent to, because I think there's maybe somebody who didn't receive it.
The memos went to the EDs and the board chairs for all the DSM boards. And so these meet and greets are for DSM boards. So if you didn't get something that you should have gotten, please shoot me an email and I'll make sure you get the communication.
All right, I don't see any other questions.
So I think that the last agenda item is just any additional questions or remarks. So I guess I'll give it just a minute or two. If y'all have additional questions, please share them in the chat and we'll respond to them. But otherwise, we'll be communicating out, you know, the next steps for the in-person meeting to get that scheduled before the end of the year, and then go from there.
Harley, there is a comment about sending the notices out earlier. I think maybe something went out today for the PD meeting, which is next week. And they were just saying it might be more helpful if we send it out earlier. So I thought I've known about them for a little bit, so I don't know when we send it out.
So that's, yeah, I understand. These are reminders that were sent out. The initial communication should have come out, but think that they were announced, and the providers or the counties for each specific regional meet and greet that information has already been shared with the dates. This was just, you know, it's closer to the meeting, so sending out the memo as a reminder. But we acknowledge that, and so we'll make sure that the communications for the ones that are later in October are sent out sooner rather than later.
All right, there's no more questions in the chat. Oh, wait a minute, another one. Oh yeah, there's just a reminder that if you haven't already, consider attending the SCAAIDD conference. The tickets are on Eventbrite, so. Harley, there's a couple comments about the initial notice going out, not including dates.
Okay.
So we can make sure the other two dates, the coastal and the Midlands dates, are a good bit further out. So we'll make sure we get those to you as quickly as possible.
Yeah, I will make sure that all the communications that have been sent out so far will get sent out again, and so that everybody will sort of, you know, make sure everybody's on the same page. So apologies for that. And, you know, again, we want to make sure everybody has the information so that they can attend if available. And we will get that taken care of this week.
Lori, Harley.
Hey, Floyd.
How are y'all?
Good.
Thank y'all for opening the mic up. I know providers, some people wanted to talk back and forth. I know people are still using the chat, and probably take us a while to get used to it, but thank y'all for definitely opening it up for discussion.
Sure, happy to do so. We appreciate the comments, and we'll continue to improve this venue for communication with the providers, I guess, right? So constantly, you know, assessing and improving is really important. So thank y'all for your comments, and you know, we'll definitely, I apologize about the, you know, if there was a lack of communication or lack of clarity on these provider meet and greets. They're very important. Commissioners will be there. Director Holloway will be there, and so we're looking forward to being in person with the DSM board providers and board chairs.
The other thing about opening up the meetings, I think it's a step in the right direction. I will say that the more information that you guys can continue to send ahead of the meeting to the email address, it just helps us be better prepared talk about anything that you have on your mind or that you want to discuss at these meetings. So please continue to do that if you can. Margaret, there's a question out here that I think maybe you can follow up on, related to whether there's a resource at HHS that could train providers on the OSS rules and billing related to OSS. So is that something you could take back?
Yeah, I'd be glad to. Might reach out, Chris, just for some additional information. Certainly on the program side, the OSS rules and reimbursement. I'll identify if we may need to bring some additional staff in from a billing perspective, but certainly we can identify that resource. If there are other individuals that would be interested in that, we'd be happy to put something together.
If I may interject there, I get a couple of times a year information about OSS billing on the listserv or webserv that comes out. So there is something, I don't know, I haven't attended it in probably 10 years, but I don't know how specific it is, but there is some OSS information that comes out on the listserv from DHHS.
And Margaret, if you set something up for the providers, it'd be great if you could include us too. I'm just interested in learning more about, like, there's a whole OSCAP, OSS. I know a little bit about it, but it's just good information for us to have too, just for knowledge base. So if you set something up, just make sure we're aware so we can sit in if possible.
Yep, happy to do so.
All right, that looks to be the end of the questions in the chat.
Okay. We'll go ahead and adjourn. Thank you all for attending, and we'll be in touch regarding the rest of the year and the schedule for 2024.
Thank you.
Thank you.